I am, 1 second. Thank you, Ron. Thank you. All right. So welcome, everyone. My name is John Troy. I'm a member of the ASDS Council. Actually, I'm an outgoing member of the ASDS Council, the Association for the Study of Death Society. This is my very last and final act as a ASDS Council member. So I'm very happy to be hosting tonight's webinar with Ronaldo Nooks. We'll be talking about the death grief tech and end-of-life care in prisons. So what we'll do is I'll keep an eye on everything, and then as other people, if they roll in, they'll just be able to pop in. But Rolando, what I'll do is I'll hand over to you, and you can start recording, or you can start going through however you want to, and then take it from there. Introduce yourself and the work you're doing, and yeah, please explain it. So the floor is yours. Thank you.
Appreciate it. Thank you. So today we're going to be talking about death and grief tech and end-of-life care in prisons, which is a underserved, I would say, environment that not many people pay attention to. We're going to be exploring the technological side of it, the emotional side, which is the grief, and the criminal justice system as a whole. This is an agenda that we're going to go over. First, I'm going to start by introducing myself. I'm going to ask you guys to briefly, if you could come off camera and just make this session a little bit more interactive as opposed to a lecture. Tell us about yourself so we could at least tailor some of the conversation about what you do and what are some of the things that you're expecting. We're also going to be using a movie called The Prison Terminal to illustrate some of the hospice side of the criminal justice system and how innovation and being a pioneer in that space can work out. And we're going to look at prisoners, isolation. We're going to have some brief more discussion, a cultural awareness about it, some of the dilemmas. And we're going to get some quick poll, and we're going to look at the technology and then next steps from an action item perspective. Again, my name is Ronaldo Nooks. I'm the founder of a company called Compassionate Reprieve. We are the first nonprofit organization that strictly focuses on streaming funeral services for inmates. And what that simply means is in the US, there is an option called furlough. And furlough is a temporary release for inmates or anyone who is incarcerated to be able to leave to attend a funeral service or to go by the sickbed or for a family member or for just emergency services. But over the last couple of years, that furlough approval ratings have gotten from maybe 25% to 0. So nobody's getting approved. And as a result of that, we're seeing some decrease in the mental health state, the physical state, and the overall impact that it has on the criminal justice system. I've been in IT for over 20 years. And my mission here is to highlight and bring attention to grief, death, technology in the criminal justice system. So again, if you're able to, I'd ask if you could get off your mic or turn your cameras on and just do a brief introduction of yourself so we can have an idea of who you are and some of the things that you may be looking to get out of this session. Elizabeth, we could start with you. You're the first person on my left.
Sure. Hi. So I am a senior bereavement counselor for a hospice organization. Have also worked inpatient hospital level palliative care, where our interactions with inmates were absolutely heartbreaking. Brought into the hospital for end of life care and chained to the bed. It was really, really horrific. I have done some volunteer work, meditation training with female inmates. And so I really appreciate the insight that you're bringing here. I agree with you, a vastly underserved population. So thank you.
Appreciate it. Thank you. Shannon, you're next on the list.
Hi, I'm a second year PhD student at Trinity in Dublin, Ireland, and I'm looking at the evolution of mourning rituals in Ireland during COVID, and the relationship with technology in that kind of mix. And one of my background is public health, so I'll be taking a public health kind of social and cultural determinants of health approach to that analysis. I'll be doing oral histories and qualitative kind of interviews, as well as maybe some ethnographic observation of how they're using technology in mourning. And one of the things that keeps coming up in my research is social cohesion and the role of mourning in social cohesion. So kind of looking at Bright et al., kind of their documentation of unclaimed bodies. There's a couple of other, but it seems like the limited information that there is on social and cultural determinants of health really is pointing towards social cohesion as being relevant. So I think definitely what you're talking about is along the lines of what Bright et al. Was talking about in New York and the unclaimed bodies during there, and then really the overall rise, and just contrasting that to Ireland, where hundreds of people show up to a funeral. So whether you knew the
Yes.
person well or not, so it's just kind of a big
Awesome.
big difference there.
Yes, appreciate it. Is it Ikumi? Okay.
Yes.
Hi. Are you able to? Okay.
Hi.
Hi.
Hi. Yes. Yeah, I am accessing from England. Yeah, I'm a palliative care researcher. I'm not clinician. I'm a medical anthropologist. Yeah, I've just started interested in death tech and what is it, grief tech. Yeah, this is completely new to me, so I would just want to collect any information, and yeah, so I'd like to
Awesome.
learn, yeah, a
Awesome.
lot
All right.
from this. Thank you.
Awesome. All right. So I appreciate you guys joining and spending a couple minutes with us today. So I'll just jump right into it. So let's first define what's death tech and what's grief tech, because there's been talks around which one to use when and what exactly they are. So death tech, for a simpler way to put it, it would be the process. It's more from a process perspective. For example, online funeral planning. You'll find that a lot more funeral homes are diving into the planning phase. Everything is now online. You're able to purchase caskets online. You're able to provide streaming funeral services online. You're able to now do a digital wall and so on and so forth from a death tech perspective. From a grief tech perspective, it's actually the technology being used. I've seen a couple things on the social media where I'm able to create a bot that emulates a loved one. If that's not scary, I don't know what else is. So what it is you would upload images or videos and voice recording of your loved one. And what the bot does, or what AI now does with that, is it actually gives you a interaction with your loved one that has passed. Now, if you've lost someone that you love, we know that the number one thing that happens is after a period of time, you start forgetting what they look like, what they sound like, what they smell like, right? So AI and the grief tech industry is trying to give some sort of alternative to that, help you not to forget. I mean, my cousin passed when I was 19, and he was like a brother to me, and I'm slowly forgetting what he looks like. Over the years, it gets worse. Now, he died when I, 19, 20, 21, he was 3 years older than me. And my last recollection of him is fading. And that's not a memory that I really would like. I don't want to lose that. I want to remember. I want to be able to say on his birthday, you were here, I remember this. But all that is gone. Why? Because the technology was not there back then for us to be able to keep that memory alive. So both grief tech and death tech are needed in the space as it regards to grief, correctional facilities, and the whole death industry as a whole. Now, I know, Elizabeth, you had spoken about being a part of the hospice program in your specific location. And based on my research, inmates are increasingly being the majority in a lot of correctional institution, for several reasons. You know, a lot of people, they're getting life imprisonment. They're spending a lot more time in the correctional facility than, you know, than needs to be. We all know that the criminal justice system needs to be reformed, and people are getting they're getting sentencing way more than they should. Now, not everyone that's in the criminal justice system is bad, but there are some people who have made mistakes over the years, and we are trying to highlight and help those people who to deal with stuff like grief and death and loneliness and isolation and so on and so forth. So prisoners that are between during that age, they age 10 to 15 times earlier than the general population, which you could, you know, you would imagine if you're not doing anything, or you're not having to deal with what's going on in the world, you know, you would think that you would live longer, but that's not the case in the criminal justice system. The other thing is caring for older inmates is two or three times costly than the average. And obviously, the older you get, you know, there's medication, you need a lot more attention, which is why we need to ensure that the necessary technology is there to plan and prepare and incorporate in the daily lives of anyone in the criminal justice system. The number one death for prisons are illnesses. Like when you're there, the food is not necessarily the most healthiest. The environment is not the most place where you could strive and be healthy and so on and so forth. So this slide is just to highlight what's going on in the hospice world. Now, I want to introduce you to Jack. Jack is a World War II veteran. He's a family man, he's a storyteller. And the reason why I wanted us to look at Jack is because Jack, based on the research that was done, and I think you had mentioned earlier, John, that you guys highlighted this movie a couple of years ago. Jack wasn't a hardened criminal. He made a mistake. He was going through stuff and he responded. Maybe most of us would not respond the way he did, but we've all made mistake at some point in our life. So wanted to highlight Jack. So with that being said, here's a little bit about Jack.
Well, my name is George William Hall, nicknamed Jack. Me and my youngest son was living in Quincy. That's when that old boy got him on dope. He was about 14 years old. And he finally hung himself. And one day this dope dealer was bragging about how he made his money. He didn't make no more. I stopped him. So I got life up here. That was 21 years ago. I'll get out of here one of these days in a box.
Now, if you've not seen that documentary, I would strongly suggest that you do. and it's called the Terminal List. You could look it up on YouTube. I believe it's also on Netflix, I believe. But if you do a search for the Terminal List, you should see it. But that was Jack. He was going through some stuff. That led to drinking, PTSD from the war, led to drinking led to isolation, affected his family, and he responded. Most of us go through stuff. And I wanted to highlight Jack from one perspective, from the inmate perspective. But I'll give you another perspective to also look at. So there's a hidden crisis in the criminal justice system. As a inmate, you're not allowed to show any type of emotion, right? You're not allowed to show any weaknesses. Hence, 60% of the inmates reported feeling isolated. As a result, there's grief. Grief results into recidivism, which translates to mental health, which ends with suicide. And the suicide rate for officers and inmates are 40% higher than the street cops for correctional officers, and 3 times as higher for inmates as opposed to the general population. So let that sink in for a moment, because this specific group of people, they have no choice. What they're dealing with is it's so bad. It's hard for me to sometimes find the words to explain it. Now, how does this tie into technology? If I were to say, Elizabeth, Shannon, Akumi, you've lost a loved one, but you know what? You have to sit right here in this Zoom meeting, and you're not allowed to go anywhere. You would lose your mind. And if I keep you there over a period of time, you're going to see the cycle of grief, depression, mental health, which will result in suicide. It's a proven fact. Now, on the flip side, meet Deputy Christina Coller, 37, reported missing, was found suicide. This was this year. And it's not that she wasn't free, but she was a part of a system that she had to deal with attacks. She had to deal with seeing dead bodies. She was working in an environment that doesn't allow for emotions, grief, empathy, or anything along that line. Meet Deputy Long. This year, suicide. Vasquez, March 2025. This year, William Bozeman, suicide. This year. What's common? They all work within the same area. They all work in the same sheriff department. Now, when you think about 4 officers within such a short period of time, there is something happening in the criminal justice system worldwide. This is not just the US, worldwide, that we need to shine some light on and find solutions to see how we can assist in any way. Now, as mentioned earlier, correctional officers are 40% higher risk to commit suicide. In New Jersey, in the United States, the correctional officer's suicide rate is twice as high as a regular cop. In Massachusetts, approximately 105 deaths per 1,000 correctional officers in Massachusetts. These numbers are crazy to me. So I know for us who is free, it's easy for us to forget that there is a population that I consider to be the forgottens, that there's death happening every day around. Now, I'll give you a little backstory. When I started this company, the nonprofit to stream funeral services to inmates, I started going around, actually went around the world, and I started to promote death in corrections. And in some cases, I would bring a casket to these shows. And I kid you not, there are folks that will D-line around my booth because they do not want to deal with death. Death that's inevitable. It's coming for all of us at one day. One day it will. But nobody wants to deal with it. So I appreciate you guys and the studies that you guys are doing in this specific area. I'd like to charge you guys to look specifically in the criminal justice system because nobody else is. As I showed in a slide earlier, there's only 5% that are practicing hospice in the correctional field. 5%. The United States have over close to 5,000 prisons, jails. 5%. Think about that for a second. The root cause, or one of the causes that and this is the reason why I started my organization, is because of that whole furlough. How does this tie in? A family member dies when an inmate is incarcerated. He or she gets denied. In most cases, there's grief. In some other cases, it results in suicide. Now, an inmate commits suicide. An officer has to deal with it who's not trained to deal with it. That's not their study. They're here to watch over and oversee you while you're in their care, the inmates while they're in the care and custody. Now they have to deal with seeing a body, someone hanging from a cell, someone slitting their wrists, right? They have to deal with that. And now they can't show any type of emotion. They've got to take that back to their family, and they can't talk about it. So they walk around with this hidden grief that nobody is able to talk about it. The other thing is, there is no, I'm going to tie it back to the technology now. There is, from a mental health perspective, there is maybe at max, depending on how much beds is at a correctional facility, there's maybe at max 10 mental health experts. Now, we've all been to universities and schools, and we know there is a teacher to student ratio. I'm not sure what it is in different countries, but I think the max here in the US is about 25 per one. So if you do the math, the average correctional facility holds 2,000 people, and you're giving them 10, that's inefficient. That's going to result in inability to properly serve the population. So I've seen where the denial of participating in cultural rituals have affected the mental health, which results in suicide in correctional facilities. I want to take a break here to ask if there's any questions. No? Okay. For Jack, that we mentioned earlier, he, I've got to give credit to Iowa State Prison for looking into the hospice program. The way, and again, if you watch the movie, you'll see this is they've really designed and they were the pioneer to find a way to humanize the end of life process for persons in their care and custody. And what that simply means, they created a room. It was, it was colorful. It wasn't as gray and dark. It was more, okay, you're on your way out. We're going to try to make it as best experience for you as possible. And I've got to I really wanted to highlight them in this presentation, just so you're aware that there's a lot of there's a few facilities out there that are actually trying to do good. So I wanted to shout out Iowa Prison for doing that. So now, how does technology and hospice come together? Because it seems like it's two different worlds, right? It's like you're dying. You think you would need the human touch, right? At that point, the human touch is probably what you really need. But if you think about it for a second, specifically for the correctional facility, again, I'm trying to show you a different side that a lot of people are not thinking about. The technology is not there to replace the human connection. It's there to enhance what's not there, to provide a solution for what's not there. For example, in the criminal justice system, you could be locked up in somewhere, and I know the US mostly, if you could be locked up in New York City and your family is in Florida. You are not driving and they're not coming to see you. It's just not happening, right? So how can we bring your family closer to you? There is, video conferences. We talked a little bit about the other digital tools, maybe some voice calls, some remote support where we can have hospice volunteers virtually connect with the person who is transitioning. You know, technology will bring us closer together. Think about this. If you go to church or you go to a concert, if you're in the front row, you're still looking at the screen. So the human side is still there, but the technology brings you closer because we're now in an era where technology is at the forefront. We can't do without our cell phones. Our cell phones is on us 24/7. You're in England. I'm in the US. We're all over the world now. And we are having a discussion. We're having an interaction. We're having a connection. We can apply that same strategy in the correctional facility space, right? We don't need to be physically there anymore. I mean, my doctor consults with me over my phone. As long as it's not serious, it's not, you know, I don't need to see him. I take my blood pressure with this device. Technology's everywhere. We have to find a way to to implement technology in the end of life process, specifically death technology and grief technology. We talked a little bit about just now, virtual therapy. We talked about the AI counseling. We didn't talk much about the digital memorial, but that's similar to what I was saying about my family member passing. And over a period of time, I'm now forgetting what they look like, what they sound like, and so on and so forth. So these are just tools that will help us or connect us with the end of life process, and using the DeathTech and the GriefTech and the technology and mashing those two things together. Real stats. Compassionate Reprieve. We've served over 150, over 25, this number has changed, but it's 125 in this slide, families so far, as it regards to the correctional space. The project Solace, AI counseling, they've served 230 inmates who receive AI grief counseling. That's a significant amount of sessions, right? And it never sleeps. AI never sleeps. Tech never sleeps. It's always available. It's always on a different time zone. It's always available to anyone who's able to use and adapt it. Digital memorial, similar to what my request was. I wish this was around when I needed it 20 plus years ago, where I could digitally remember my family member who was passing. Here are some more examples. We talked about this before: the virtual streaming funeral, the digital legacy, the phone calls, similar to what we're doing here. Now, let's talk a little bit about the impact on the criminal justice system. It has been proven that when you humanize inmates or persons that's in isolation, you can have positive effects, right? And one of the ways we could do that is the use of technology. My brother, who is still incarcerated, a backstory. The reason how I started this company was a couple of years ago. My brother, who is still incarcerated, our grandma passed. And I was like, well, we should probably stream the funeral services to you, so at least you could be a part of that session. And he said, it doesn't exist. Nobody is really doing this. Now, this was pre-COVID. When COVID happened, and Zoom, this platform that we're on, became popular. And now we're starting to utilize technology a lot more efficiently and effectively. So there's been a huge impact, and it's still growing. I'm still pushing the envelope. I'm still trying to change mindset in the criminal justice system that we need to use technology, especially when it comes to end of life, because when someone passes away, there is no redo. We don't get that moment again. We don't ever have the opportunity to talk to you. We don't have the opportunity to say goodbye. We don't ever get the opportunity to hear your words again. It is very essential for us to consider implementing technology, death tech, grief tech in the correctional space. Because as family members with persons who are in the care and custody of the criminal justice system, options are limited. So I challenge policymakers worldwide to look into how we can implement these two things in the system that will help with hospice before they die, help after they die, and to maintain their memory over a period of time. We talked about the cultural impact, right? Some people celebrate end of life, differently. Some we do funerals, some they have different rituals. So identifying all those groups of people and how we can use technology to service them is one of my charge and mission as we move forward in our endeavor from a nonprofit perspective. Now, we talked about Jack earlier, Jack Hall. Remember Jack? Unfortunately, Jack passed. It's very sad that he passed, but I'd like to use him a lot more in a lot more of my presentation because he has a real story. He has a story that we can all, I guess, identify with in some cases, not in its entirety, but just we all make mistakes. We've all done something dumb, and it's just by luck or the grace of God that we're here free today. And we have to always remember that there is a group of persons or people that they don't have the options that we do in the free world. And if we could use technology to help connect with them, because again, everyone will pass at some point. It's just a matter of time. It's not a if, it's a when. So while we have them and while they're still available to us, we could use the technology that's currently available, and it's going to get way more as time progresses, but use the current technology that we currently have available to make that connection and help them to transition through that final phase of their life. With that being said, open the floor. We've got about 13 minutes to more discussion. I'd like to hear your thoughts on, what is death, grief? What is your understanding of death, grief, and technology, especially in the correctional space? Elizabeth, I'll start with you.
I keep getting picked on. I'm lucky me.
You're the first on my screen.
Not at all. For me, it begins with, of course, I come from a social work perspective, just the essential dignity of all humans. And that that's not negated just because you're a person who's maybe made some mistakes, or, who are we to judge? The essentialness of humanity, and death, dying, grief, loss, these are all the things that it means to be human. right? So if we cannot recognize that and support that in our prison systems, that says something about the society that we're living in. And not something great for that matter. So just the idea of introducing technology, I mean, I appreciate your discussion very much. Recognizing that absolutely technology is not the same as in-person contact, but it is better and more than no contact. And that anybody would be subjected to an end-of-life experience in which they're denied sort of fundamental human presence or human contact in any way, shape, or form is criminal, frankly. We want to talk about criminal. And I suspect that many of the correctional officers who are witnessing this, that must be very distressing to witness people's final moments without connection to the folks around them. And of course, and then the family response that they're going to have to deal with. And this is how you create a legacy of trauma and epigenetic change, where the people who are living have to continue their lives dealing with the repercussions of never even having an opportunity to say goodbye or connect or see, to believe that it's even true, right? Sometimes you don't see these things with your own eyes. It can be really hard to process.
Yeah.
So the whole range and how not connecting folks in this environment can impact generations.
Absolutely.
And so, I think that what you're doing is incredibly important on a variety of levels, for the dying, but also for the living, and for who we are as a society, frankly. So micro, macro, all the levels. Yeah.
Right.
Those are my thoughts.
I appreciate it, Elizabeth. Shannon?
Yeah, really interesting, especially with what I've just been doing my literature reviews. So, because several things sort of rang a bell to me, what you were talking about. One of the concepts is something called grievability, which is something that Judith Butler talks about, which is basically you have to be considered human in the first place before you can be considered grievable. And coming from the U.S., I can see that there's a lot of social determinants of health that even land you in prison to begin with. There's a lot of inequity, and it's so, and to see that sort of kind of be perpetuated in the family of the person passing away in prison, not having the ability to grieve physically and culturally in their normal way, puts them at risk for prolonged grief disorder and disenfranchised grief and kind of all the things that go along with that from a mental health standpoint. I do worry about like uncritical adoption of some of these tools, which really haven't been assessed. And I think coming out of COVID, we do see some evidence that some of these tools didn't really help. In fact, some of them can hurt. So I would be concerned about that. But again, is it better than nothing? I think if you come back to that same question we had at the beginning of COVID, I think something is better than nothing. But I would hope that there's more research that comes out and maybe brings this need kind of more to the forefront. It's interesting also with the suicide. One of the things, because I was looking for evidence of cultural determinants of health in mourning in general, and then also with technology in mourning. And something I did find that was rather interesting about mourning. Sorry, I'm going to back up there. One kind of piece of evidence I did find as far as culture and health was related to a study of indigenous, most of the cultural determinants of health are covered by indigenous scholarship. And one of the things I found is that Chandler and Lalonde saw that cultural continuity, which is kind of that continuing of culture and your normal practice, was associated with lower suicide rates when controlling for pretty much everything else. And that's, I think, a really interesting thing because, like you mentioned, there's lots of different cultural practices associated with mourning, but it's a really important one. Like it's something that, you know, you can't really redo. You can't do it over. And not having the ability to engage in those normal practices was associated with suicide. You know, that's it's an important matter of life, I think. So you know, I think it's worth looking into.
I appreciate it, Shannon. Ikumi? Okay. Well, I would say, you know, what I charge you with doing, and I'd like to, you know, follow up and keep in touch with you guys just to see what your research and what the work that you are doing. Hi, Ikumi.
Can you
We can
hear
hear
me?
you now. Yes.
Sorry, I'm accessing from the phone, so
Okay.
it's really hard. Now I cannot hear you very much. Sorry.
Oh,
Yeah.
no worries.
Yeah. But yeah, it's a really interesting talk. Thank you. Yes. Yeah, just related to what Shannon said. Yeah, I'm also interested in this the effectiveness of this tech-assisted intervention. Yeah, because as also she said, mentioned, it can be, yeah, for some people it doesn't work very much, or even harmful sometimes. Yeah, and then especially yeah, this kind of technology could be quite expensive. So kind of cost effectiveness, I would be a bit interested to hear. And then also you mentioned AI grief counseling. I just wonder what it is like. Is it the bot thing or?
Yes.
Yeah.
Yes.
Mm.
So a little, just to answer your question, yeah. So
Yeah, sorry, I cannot
there's-
hear you very much now. Sorry, my phone is. Yeah,
can you hear me?
yes.
Okay. I was saying that the AI bots are exactly what you had mentioned. They're becoming a lot more smarter now as they're putting more like a face to the conversation. In previous, I'd say months or years, it used to just be text. Now it's no longer text. It's a familiar face. It could be John, it could be Rolando, it could be Shannon that's talking to you and giving you advice. And you know, AI has been so it's so futuristic where it's understanding words. It's not just text anymore. It's understanding words. It's understanding images. Like for example, I'm piloting a program where when we stream funeral services to inmates, what we want to do is capture their emotions during that time. And what we're looking for is, are they suicidal during this time? What are some of the effects of this funeral, them participating in this event? What are are they going to be suicidal after this session is finished? What were they suicidal before? A human is not necessarily going to be able to detect some of that, right?
Okay.
And because there's a lot more into it. They're looking at, you know, they're looking into your eyes. They're looking at the way you respond to certain images. So it's getting scary deep how AI is being integrated into our daily life. So hopefully that answered your question.
Yeah, yeah. Thank you. That's really interesting. Yeah. Thank you.
All right. I guess I'll pass it back over to you, John.
Yeah, so Rolando, I don't. So I just had a real question too, but I want to make sure everyone got a chance. Which is just how much, like how much access do you find that the individuals who are incarcerated do they? You've kind of talked about, do they actually have to the tech? Because I know there's a real issue sometimes with even like having access to email, let alone, anything. And if you do have access, that can cost a fortune because there's a kind of extortionate,
Yeah.
system of payments in prisons in the US and things like that. And that's one of the things I've always wondered about because what I come back to is I think everyone's going to talk about this, which so we have these tools, but if we're going to put them in an incarceration system that's already taking advantage of people, it seems to me this just becomes another way to like extort more money out of people who are already, getting paid not even like way below any acceptable wage to like work in the do you know what I
Right.
mean? So I'm just curious what you
Right.
found with that.
Yeah, so you're correct. That's when I go to these conferences, I would say 99% of the vendors there are in it to make millions, if not billions.
Right.
Like
I shouldn't laugh.
everything,
It's not funny,
yeah,
but like, yeah, of course.
it's a reality, right?
Yeah.
They're there to cash out. They're not looking at the human side. They look at persons who are incarcerated as numbers. The apps for emails is, I want to say last I checked, maybe like $1 a message. Like,
Yeah, yeah,
and you're limited to a certain amount of characters. So it's not like you could just put
yeah.
everything in it. You know what I mean? So um it's very expensive. What I'm trying to pilot now is going to be significantly expensive as well. But I'm looking for grants. We're a nonprofit, so I'm not, it's not
Right.
a paid service by the inmates or the facility. We're looking for people who are wanting to change the world and have an impact on this forgotten population.
Right. Okay. I was just curious. No, it was good because I forgot I forgot that sometimes that's right. I'd heard about you have to pay for the email, like literally, because it's so easy to take that for granted. Like, well, who pays for email? Like, if someone told
Yeah.
me I had to pay to email them, I'd be like, well, forget about it. I'm not going to email you then. Like,
But when you don't have a choice,
no, and I
when
know
there's no
but you don't have a
options,
choice. Like, if you're like, well,
yeah,
like, can I? Well, calling isn't an option too, but I mean, I think partly I'm also interested in this because I think this also explains why there's such an increase in like phones being smuggled into prisons because I think partly, I mean, you can use them for whatever you want to, but if that's your only connection to try and do like free communication, though, then you might be paying someone else. I mean, there's all these economies that emerge, and I think that I can totally understand that would work. Anyway, I'm sorry. I'm taking us down this whole. We're now at time. It's good, but I think that to me is always one of the things that comes away with is like you've got the access, but how much is it going to cost? Who's going to pay it? How do we, those of us who don't have to think about these things, just sort of like go right past the fact that there are all these economies that can be involved that like just totally disenfranchise or disadvantage people. Well, disenfranchise too, for that matter. Anyway, but so Rolando, thank you so much for a great talk. It was super interesting, and I'm very happy that this was my final duty as an ASDS council member. Finally,
right.
after all these years of being an ASDS council, I think this couldn't have been a better event than this to actually do something with. And I'm very happy that it was recorded and to spread the word. So if you're watching this in the future, know that this was a great event, and everyone should please contact Rolando about like the work and if you have any ideas about that way. So great. So thank you, Rolando. Everyone have a great night or a great rest of your day. It's night over
Yeah.
here in Europe, and please come to the other upcoming ASDS events, all of which you can find on the deathandsociety.org website. I know this because I'm the one who set up the original website and bought that domain name back in 2009. That's how long it's been. So very good. All right, everyone, have a good night. Take care of yourselves.
All right.
Thank
Talk
you
to you
very
soon.
much.
Bye.
Thank
Bye-bye.
you. Goodbye.